Are you also suffering from hair loss? Then you should watch this. The hair growth cycle. First, you should know about these things. The hair growth is cyclic. There are three phases of the hair cycle. First one is anagen phase, second one is catagen phase, third one is telogen phase. Now we will see these three phases, what that it includes. In first anagen phase, where the growth of the hair occurs, and in second catagen phase, where hair is at resting period, that means hair is neither falling nor growing, and third one is telogen phase, where hair falls. Normally we will see the 80% of people hairs are at anagen phase, and the 20% of people are suffering from catagen and telogen phase. Just like we have seen the catagen and telogen phase, one is resting period of the hair and one is falling period of the hair. You should also know the hair falls. Normally in day to day life, 50 to 100 hair every day. We should also know the common varieties of hair loss occurs because of some conditions or some diseases. So common varieties of hair loss occurs because of common male baldness, which is androgenic alopecia we say. It is seen in male who have a family history of baldness. It is seen in male frontoparietal area, the hair falls with thinning of frontal hair. In most of the cases, parietal and occipital hair stays. That means only frontoparietal hair fall occurs of that area. Only in severe cases, all hair will be lost. But in females, instead of frontoparietal hair loss, there is a frontocentral hair loss. We can see in females there will be frontocentral hair loss. Now move on to second condition, which is telogen effluvium. It is the telogen phase where hair loss is profuse. Pull your hairs slightly, not applying that much of pressure. The bunch of hair will fall into your hands. It's like that. This condition is telogen effluvium, the shedding of telogen hair. Now we will see alopecia areata. It is a well-defined round or oval bald patches occurs on the scalp. That means a certain area in a round or oval shape of that area, the hair will fall overnight. It can happen sometimes overnight. And it is common in youngs, adults and children. There will be no itching. All hair can be lost. All hair can get lost from the scalp. So we named that condition as alopecia totalis. That means all hair is lost. Now move on to the condition alopecia universalis. That is, all body hair will be lost in this condition. Now we see a condition trichotillomania. It is a psychic condition, or it happen in children who have the habit of pulling their hair. It happen in children who have habit of pulling their own hair. It is named as trichotillomania. Next one is traction alopecia. It is a condition happens in girls who tie their hair too tightly. Now we will see tinea capitis, the fungal condition where hair follicle fall in a broken like phase. That means hair will fall and there will be itching. The person will be start to itch, which causes hair to fall. Now we will see scarring alopecia. So what is this? Scarring alopecia, where the root of hair follicle is permanently damaged, which can be due to trauma or destroyed by some burn or friction or pressure, or maybe due to use of cosmetic use like bleach use, or maybe by wearing headgears, long term of use of wearing headphones, and due to deep folliculitis condition. So you know folliculitis where the hair follicle get damaged, but in defolliculitis the inflammation of hair follicle go deeper into the skin, which causes pain, scarring and hair loss. Now we will see the person who is suffering from anemia, kwashiorkor, hypothyroidism, or any anti-cancer drugs if he or she is taking, this condition will also cause hair to fall. It will cause hair loss in a person who is suffering from this condition. If you have all these conditions, go and see a dermatologist. Don't waste your time.